Can therapy cure trauma? Let's talk about it. Hi and welcome everyone to Let's Talk About It podcast by SafeTalk, where we cover all things mental health that are rarely talked about. And in today's episode, we are going to be covering and understanding about trauma as well as learning how to approach healing in a supportive way. So joining me today is Betty Lim from Karakara. She's a mental health therapist and she will help us explore the concept of trauma-informed care and answer some questions about trauma. So welcome, Betty. How are you doing today?
Good. Thanks for having me here. How are you?
Yeah, I'm good. Thank you for coming, by the way. And so since we're going to be talking about trauma, but first I would like to know a bit about like what you do in your profession and what you mostly work on, if you could share.
Right. So I am currently a mental health therapist, so I'm waiting for my licensing at this point in time. In my practice, in practicum as well as during internship, I've worked with mostly young adults as well as working adults, and in those settings, I work a lot with depression, anxiety. I am very passionate about the topic of trauma, and so I do approach therapy from a trauma-informed lens as well. But I must say, it is also something that I've only developed in the recent year, like in the past year or so, based on my experience of working with these individuals. But you know, all of the different presenting issues that come with trauma, like depression, anxiety, lack of motivation, relationship issues, as well as self-understanding, perhaps. So those are my main areas of interest.
I see. So that would be perfect for our topic today. And but first, let's just get into the basics, right?
Sure.
So what is trauma?
So when we talk about trauma, it is essentially the result of an exposure or repeated exposure to a series of events or incidents that are unexpected or emotionally disturbing or could be life-threatening as well. So generally when we talk about trauma, we talk about events or incidents that are significant enough to trigger a survival response. So when we talk about survival response, we generally talk about the 3 Fs, right? The fight, flight, or freeze. But of course, it manifests in many different behavioral ways. So it could be things like avoidance, or it could be things like freezing, meaning I really just am not able to respond in the situation, things like that. But the main point about trauma is that the incident is significant enough for it to overwhelm one's capacity to cope.
Okay.
Yeah. And so in those instances, because they struggle to cope in that event, there is also a struggle to maybe reconcile and make sense of the event.
Right.
Post incident. And so when we talk about trauma, you know, we talk about it being significant enough for someone to experience some lasting impacts, be it mental, emotional, even physical. So something that we can think about when we talk about trauma is thinking of it like an unhealed wound.
I see.
You sustain the cut, it's struggling to heal, and what happens with wounds that are not healed? It's your pain receptors are definitely going to be very activated around the area.
Right.
It may be more susceptible to infections, you know. And when we talk about trauma, we can also liken it to physical trauma. So if someone were to get into an accident, they bump their head really, really hard, they come in and the surgeon says, oh, you have traumatic, sorry.
It's okay.
What is it called again? Traumatic brain injury,
Okay.
yes. And you know, when we talk about that, that comes with lasting physical impacts, right? Impacts on your memory, impacts on your verbal comprehension, for example. So it's very similar to that sense, but within.
Right. Mentally.
And emotionally, yes.
And there's no like specific list like, oh, these 10 things are what is considered trauma, right? Like there's trauma is, what do you call broad.
I think in the past there used to be a pretty general understanding of trauma as PTSD in the DSM, but I think in the recent years it's kind of broadened up in its perspective to incorporate a lot more than just PTSD.
I see.
So with PTSD in the DSM you see there's a list of symptoms, but it can manifest very differently. For different people.
So you can have trauma but not have PTSD, right? Basically. Okay. And so my next question is, does every single person go through trauma?
So from my understanding, the majority of people that do come to therapy have had some kind of traumatic experience, but it doesn't mean that everyone will experience trauma.
Okay.
And that just goes to highlight the subjective nature of trauma, right? No two person will experience the same event the same way.
Right.
So just going back to the analogy of the unhealed wound, some people may just sustain a superficial cut and it can just heal on its own. But some people, if they've experienced an injury in the same area, may sustain a deeper wound, for example. Okay. So it's very nuanced in that way. It's very subjective. It's incorporates a lot more factors than just, exposure to this event. It's also got to do with everything that perhaps happened in their childhood, everything that happened leading up to the event, their social environment, their community environment at that point in time.
And how they recover.
Correct, yeah.
I see. So, kind of like you said, back then people had more like general understanding of trauma. So 2 years ago, before I learned more about mental health, I would have thought of the same. Like if someone says trauma, I thought, trauma means accidents, trauma means abuse, like serious like abuse, assaults, disturbing events. But I didn't think trauma would also be like a series of small things that kind of like disturbs you, and like it's complicated, but over time it affects your mental health, right? So as a mental health professional, is there such a thing as small traumas or things that people or experience that people don't really recognize as trauma, kind of overlooked things?
So these days, I mean, if you were to go online and search small t trauma, it's something that comes up as well. It's gained a lot more recognition over the last couple of years.
Yeah.
And you're right to say, like, there's big T trauma and there's small t trauma, right? So with big T trauma, it's like what you described, the abuse, assault, accidents. And these are things that are easy to identify as a traumatic event because it's life-threatening.
Right.
But when it comes to small t trauma, it's a lot more subtle. And a lot of the times it's sustained and persistent over time. So this could be things like neglect. Neglect in one day may not impact you as much, but over time it does leave a lasting impact.
Right.
It's a lot more subtle. It's not as easy to identify. And also because of that, the experience of it can be so different.
So it really depends, and it's not just big trauma, there's also small trauma basically. And it seems like not many people realize that some of their past experience could also be considered as trauma. So maybe when they come into therapy, they're like, this is my trauma, this is what leads to how I'm feeling today. But is there such thing, or is there anyone who has this sort of denial, like, I don't want to accept this as my trauma?
I must say that over the last couple of years, because of the awareness that's been growing around the topic of trauma, that a lot of people do come in and say, I think this event really impacted me. And it's, brought forward to this day. But the denial is still quite common. And only because, like what we spoke about, small t trauma is so subtle, sometimes people don't really realize it. And just to give you an example, like for example, with parental neglect.
Right.
The denial comes not just because I don't want to accept that I'm going through trauma because of it. Or that it left a lasting impact. The denial also comes from understanding my parents had to really work. They had to really hustle. They had no choice.
Right.
And so there's this sense of maybe I'm not allowed to respond to it because there's an understanding. But the thing about trauma is that you can understand why things happened. And even then, it doesn't take away from the fact that it left a lasting impact on you that changed the way you perhaps relate to people, relate the world, perceive people, perceive the world.
So it's like the example that you shared, it's kind of like guilt, right? Guilt, and also some traumas like you compare yourself with other people, like, this person go through the same, or someone else has gone through worse, but why am I feeling this way, which is worse than others? So but is it important part of therapy for you to be able to acknowledge that it is a trauma?
I think it really depends.
Okay.
So, to some extent, I do think if it pertains to the presenting issue, then we will definitely need to work to some level of acceptance.
Right.
But if it's just a factor that came into play in terms of how we understand what the client is going through right now, and for them it's like, I can't really accept it, it's a bit hard, but being able to bring that to awareness sometimes is already enough. It's
an acknowledgement at least.
Yes.
I see. And So that is one thing. I come up with another question this morning. I don't know if this might not like sidetrack too much, but it's about false memories. Do people develop false memories where they think, oh, this thing happened and it upset me, but it actually never happened? Does that happen to people?
From my experience of working with individuals, within the realm of trauma anyway, I haven't seen that happening yet personally. But false memory is a real thing. You know, there has been social psychology researchers on this where they go around and they say like, do you remember going on a hot air balloon? And then at some point the person's like, yeah, maybe I did. Yeah. So I think it can happen. And I suppose it when I think about it now, I suppose it's something that could really take place in under the context of manipulation, or like mental abuse, for example. But obviously, it's not limited to that. But just off the top of my head,
I see. Okay, that makes sense. And a common pattern that I see when someone expresses their thoughts and feelings about trauma is others might interrupt and say, oh, I have clinical depression, but I don't act this way. Even amongst people who acknowledge their own mental health struggles, like people who get themselves diagnosed. But for example, when they see a person who is going through a mental health episode, and let's say they struggle with hygiene, and they couldn't take care of themselves or their families, their children, so people would come in and say like, oh, I didn't struggle with hygiene, like why couldn't you? So there's this sort of mindset in certain people, is that if I can do it, why can't you, right? So how do you handle this kind of reaction from people?
A lot of times, so I'm going to cover a couple scenarios, okay? So with regards to what you asked, if it's someone coming in expressing their grievances over someone else's struggle to cope, even though they've gone through something similar,
right?
A very important part, obviously, is to validate their feelings and validate their experience, validate their frustration, and try to build an understanding of where this is coming from.
Okay.
But at the same time, something that is important to address with the person who is being compared, meaning if a client comes in and they say, I don't understand why I can't do it. They could do it. You know, it's important to validate the experience, number one, validate the feeling, and at the same time also gently remind them, you know, everyone goes through things differently. Everyone have different capacities to deal with things differently. And just really going back to that subjective nature of trauma. But at the same time finding a balance with that, you know, and also validating, I know it's very frustrating for you. This is difficult. But at the same time, this is also your experience. And also highlight that you're doing your best.
Right.
You're doing your best to cope in the ways that you know how at this point in time.
So that's how you can communicate to the person if someone says that to you. And and it also reminds me of when people pointed out that some people say mental health matters, but only if it conveniences them. So I don't know if you know this, but a while ago people were bringing up the fact that some cares about mental health, they raise awareness about mental health, but then when a person is struggling with severe symptoms, right, like what I said, poor hygiene, isolation, or when their mental health affects family, friendships, and jobs, so people start labeling and saying, oh, it's irresponsible, it's disgusting, lazy, when that is unfortunately the ugly truth of someone who has completely burned themselves out. And a good example is as simple as you plan to hang out with your friends, but then your anxiety got triggered and then you had to do like a last minute cancellation of the plan. So not everyone can accept that. It's kind of the same way, it's like, why can't you just do it? But my question would be, should someone dealing with trauma be held accountable for their actions that might affect others?
So I think something that we can try and reframe first before we move forward here is to try and kind of change the word held accountable. It sounds very harsh, right? But I think something that we can move towards is to maybe move towards encouraging someone to take ownership of their actions or their choices. And something that we need to do here in that gentle encouragement is to connect with them. You know, like for example, with the example that you gave, a friend bailing because their social anxiety acted up. You know, connecting with them and asking, hey, what's going on? You know, are you okay? Is everything okay? Trying to understand really what's happening.
Yeah.
and empathizing with their experience.
Yeah.
But at the same time, also communicating with them. Oh, I was really looking forward to this,
Right.
But I understand where you're coming from. But at the same time, also maybe collaborating with them in figuring out, okay, I know this is very difficult for you. Now that you've shared it with me, I understand a bit more. But I would really love to spend more time with you, for example. So what can we do in the future for us to be able to hang out more?
Right.
But at the same time, coming from the person who is communicating this to a person dealing with trauma,
Yeah.
is a lot more difficult than what I described, obviously, because there's feelings and all that kind of stuff involved, right? So on that note, it's also very important to communicate about boundaries in this particular instance, especially in the collaborative part of the relationship.
Yeah.
In saying, I can probably support you through these,
Yeah.
but here onwards, I will need you to try, or I need
Right.
you to do this, but we can figure out what is it that you're comfortable doing first. And of course, if it really comes to a point where it's a helpless situation where I don't know what more I can do for you, you also feel a bit stuck, encourage them to go and seek help.
Right.
And be like, I'm here for you.
Right.
Yeah.
So you don't, and just because the other person is struggling with their mental health, you don't have to sit here and be like, oh, they have anxiety, so my feelings isn't valid. But you still have to acknowledge that, okay, because they canceled our plan, I still did feel upset and wanted to, and I looked forward for it. So that is, like you said, understanding, and it's also important for both sides, right? It's not just for the other friend to be like, oh, I understand your anxiety, but the person with anxiety should also communicate it with their friend.
And in collaborating with them and connecting with them in that way, I mean the person who is dealing with trauma, it can, when the balance is struck out nicely, which is difficult, I acknowledge, it can actually be a very empowering experience for the person who is dealing with trauma, for them to realize, oh, I have someone who will be there for me. I have people that I can rely on. And there is also that sense of, oh, perhaps there are other ways for me to approach my struggles. And so it can be a very empowering experience for them if done delicately. Yeah.
Even though I'm going through this episode, there's someone who's still patiently waiting for me and like is understanding enough. So maybe next time I can do something else for them as well.
And more importantly, like what you mentioned, someone is there and willing to understand from my perspective what I'm going through. Non-judgmental, safe space.
Right. Because I feel like some people have this sort of pressure that I have to get better for this person. Like when people ask like, oh, how are you doing now? It's like, oh, now I feel like I have to be okay. But it's important to have that person who is still there regardless of your progress. And so with all some people endure trauma for so long because they never understood that it's not healthy. Trauma is their normal, and especially for children who are raised by toxic or emotionally immature parents. And I have a quote for this I saw the other day. It says, someone once asked me, why do you always insist on taking the hard road? I replied, why do you assume I see two roads? So because to some people this is their default life. They don't know what the other side of it looks like, right? So I felt and seen how this affects people in their adulthood. But can you explain the impact of unaddressed and unresolved trauma?
I think the quote that you shared just now was actually very significant. Like what you said, why is it that you think that I see two roads? Right? And this really relates to what we spoke about just now. In that the person has been in that environment and that setting and going through that for so long that it's become, like what you said, their default. It's familiar as well. And sometimes deviating from familiarity can come with a lot of fear because there's a lot of unknowns, right? But just coming back to your question, with regards to unaddressed and unresolved trauma, it really truly can manifest so differently for different people. So I can give you an example. Person A and person B went through a significant event, and the theme that surrounds that is abandonment.
Right.
Person A may come out from the event learning or realizing that in order for me to not be abandoned anymore, I need to constantly create value for myself.
Right.
And so what do? They pour their entire selves into their relationships. They give their everything. They exhaust their resources. They pour all their love into people so they are valued enough to avoid abandonment. But conversely, person B may learn, the only way for me to feel hurt through abandonment is if I love the person, or if I connect deeply with the person, or if this person means a lot to me.
Yeah.
So what do? They just choose not to connect. They
At
just
all, yeah.
And so, like, from that example alone, you can see how differently it manifests, but it comes back to the same theme: fear of abandonment, right? But if we were to just break it down to the basics of trauma, it's fear. Right? There's fear, there's helplessness, there's vulnerability, and when we're afraid, we become protective of ourselves. Our brains are hardwired for survival, right?
Yeah.
And so we become hypervigilant. The hypervigilance in the sense that they're constantly looking out for whatever that could potentially hurt them. For example, the abandonment, right? And then when we think about that, what we see is a general sense of need for control. I need to control. So there's this increased sense of control. But then after that, on the flip side of the same coin, there's very little trust. Not just towards the world, not just towards others, but also towards themselves sometimes. Right? But this is just a generalization. It can manifest very differently. But, for example, with trauma, we also see a lot of shame, a lot of guilt as well, especially with things that relate to abuse, maybe.
Yeah.
There's a lot of, why did I allow myself to go through that? Why did I let them do this to me? And that inevitably will impact the way they see themselves as a person. It impacts their self-esteem, it impacts their sense of self-worth. And that can bleed into so many aspects of their lives. How they function socially, how they function at work professionally, how they function on their own.
Right. So there's so many effects to it if it goes unsolved. Right.
And it's not just the emotional and mental side. Physically, if you're constantly afraid, stress, hormonal imbalance, diseases down the line. So it's not as direct of a correlation, but it's something that could build up over time that leads up to different physical manifestations of prolonged stress.
Like a domino effect.
Yeah. And then if we take a step back from all the symptoms of trauma, unaddressed and unresolved trauma can get passed down. Then we get generational trauma. Essentially, it's like hurt people, right?
Yeah, heal people.
So it perpetuates the cycle of trauma within a system, within a community, within whatever.
Right, I see. And so with all these effects and struggles that result from trauma, right, one of the things that obviously that might help is therapy. And so I've heard that therapists or healthcare professionals practice something called trauma-informed care. So can you kind of explain a little bit what exactly is trauma-informed care?
Okay. So trauma-informed care, I think something important to note is not the same as trauma-specific interventions.
Okay.
Yeah, so when we talk about interventions, we're talking about things that are put in place to carry out therapy. So for example, if we talk about dealing with the immediate effects of trauma, we have psychological first aid. We have regulation, trying to ensure that the client feels emotionally safe. And then beyond that, we have other things like CBT, EMDR, which is eye movement desensitization and reprocessing.
Right.
And then exposure therapy, for example, and cognitive processing therapy. But obviously, it's not limited to that. But trauma-informed care it kind of takes a step back.
Right.
It's a general culture and approach to the way therapy is being carried out.
Right.
Yeah, so a lot of times with trauma-informed care, something that we try and emphasize on is safety as well as collaboration. And something that is very important to note with trauma-informed care is it kind of steps away from the traditional perspective of trauma, which is just PTSD, but it also recognizes and acknowledges the subjective nature of trauma as well as how pervasive the impacts of it and how prevalent it is in our society. Right? And with regards to safety, like when we talk about trauma, there's so much fear and vulnerability, right? That safety is so important. So when I think about, from my perspective, when I think about trauma-informed care, it's a lot of elements of it are things that are already happening in normal therapy. But it's it's something that is emphasized even more. That sense of safety is already happening in the therapy room.
Right.
But it's something that we do even more, and more specifically, we do our best to try and minimize the risk of re-traumatizing our clients. And this is more nuanced than it seems, because, for example, regulation techniques, we think of breathing, we think of grounding. But what if silence is attached to the trauma?
Okay.
So it really comes with also that collaborative relationship of trying to understand trauma from that perspective. Tell me a bit more about how this is impacting you.
Right.
And with regards to minimizing trauma, it's not so much about focusing on the story or the event. We are focusing on the impact, because when they recall, it could also
Triggers.
correct. So when we talk about minimizing risk, it's really collaborating with them to understand, hey, am I understanding you correctly? Is this working for you?
Yeah.
And something that I like to tell my clients at any given point in time, if you start to feel overwhelmed, say, Betty, I want to stop.
Yeah.
Okay? Maybe we'll take a walk around the block or something like that. But it's really working within the client's level of comfort, level of readiness, so that we don't perpetuate the trauma, perpetuate the fear.
Yeah, so like you said, it's not just about the story. It's about how they react and handle their, carry the conversation and all that. And I also watched a doctor kind of explain about trauma-informed care, because she is a medical professional. I think she works in emergency or something, and that like she has what do you call it? Not clients, patients. She has patients coming in, and like she always keeps seeing the same person coming in, and like going to emergency, coming into the office, and then it kind of like it's a bit weird. So she said that instead of asking what's wrong with you, she changed to what happened to you, because most of the time it's like the domino effect that we talked about. It manifests into different ways, so we can find the root cause of it and be more gentle to the person. Yeah.
And I think what happened to you is such a good question, because it doesn't focus specifically on just the trauma. It also opens up the perspective to all the different factors that's happening outside of the individual level that could have contributed to the trauma, as well as perpetuate the current experience of trauma.
Yeah. So and okay, I think you already answered this, but is there anything else that you could highlight about therapy that really helps trauma survivors?
I think like what we spoke about just now, right?
Yeah.
The minimizing risk of re-traumatization, it really comes back down to that therapeutic relationship.
Yeah.
It's already a very important part of therapy in general, but even more so with trauma-informed care, because when someone comes in with a struggle to trust, or someone comes in with so much fear and vulnerability, if they don't feel safe, and like what you said, that shame just now, like what's wrong with you, will come up, right? And then it's just a perpetuating cycle of like, oh, I should be able to do more of this, I should be okay by now, people don't understand me. And then if the tenets of trauma-informed care is not there, what if we end up traumatizing the client as well, with regards to trauma specifically? So that safety, like what I said just now, is a huge thing. The collaboration in the relationship is so important, as well as that question of what happened to you instead of what's wrong with you. Really seeing it from a wider perspective. What's in their social environment that contributed to it, what's in their childhood that contributed to it, what's in the cultural, social, political, cultural environment that is contributing to it or perpetuating it.
So if someone who is going through trauma or is a trauma survivor, they don't have to fear therapy, like, oh, I come into therapy, now I have to tell everything about my trauma. I think like maybe someone would be like scared about that fact. So do all therapists know trauma-informed care, or if you are a trauma survivor, you should look into like what this therapist specializes in?
I think it definitely helps for a therapist to be trained or to have gone for some training with regards to trauma-informed care or trauma in general. Because like what we spoke about, right, trauma is so nuanced. It's something that needs to be approached with care. And while I believe that therapy in general and counselors and clinical psychologists are all trained to to provide that safe space, that's non-judgmental safe space for the client, it does help for them to have an understanding of trauma. Trauma training goes right down to, how it physically manifests, right down to your hormones, right down to your nervous system. For them to be able to understand and conceptualize trauma from that point of view can be very helpful.
Right.
But at the same time, therapy is something that it's a bit like taking medicine. Not every single medication that works for people may work for you.
Yeah.
It's the same as having a physics teacher who is very knowledgeable, but if the physics teacher is not able to teach you in the way that you are able to receive information, it's not going to work also.
Right.
In the same vein, if you have a physics teacher who doesn't know as much, but is able to convey information to you in the way that you're able to receive, then it can progress, right? So that was an analogy for your question, that they can be trauma informed, but at the same time, if you don't click with your therapist, it's going to be a struggle.
Work,
And something I want to point out here is that as a client, you have the right to move to a different therapist if you don't click.
Yeah.
But something that I can advise clients to do, and people who want to seek therapy potentially for trauma, is to reach out to the center or reach out to the therapist and be like, hey, I'm going through this, share very brief information about what you want to cover and see if it's something that they've worked with.
Right.
And see if you gel well with them. Because at the end of the day, like what I said, the therapeutic relationship is at the very core of any therapy, not just trauma-informed care.
Yeah. It's just it's an option that you can look into if the therapist does provide like trauma-informed care, but there's also always an option for you to leave and look for any other resources and therapists available.
For sure.
Yeah. So kind of go into the trauma survivors during therapy itself. What are the challenges that trauma survivors have to go through during therapy?
So there's now like what you pointed out, right?
Yeah.
Telling the story can comes with so many feelings.
Yeah.
There could be shame, there could be guilt, there could be frustration, there could be anger. And needing to talk about it in therapy can be very daunting.
Yeah.
And so that's probably one of the bigger challenges. And I don't think that's just, with regards to people who have dealt with a traumatic experience or are living with the effects of trauma. It's just people in general. People come into therapy and they're with a stranger, right? Essentially, it's a daunting experience. But at the same time, I think something that is quite common quite a common challenge among trauma survivors is perhaps the acceptance that this happened to them.
Yeah.
And that it left such a lasting impact. Coming to an acceptance and also coming to a place of compassion towards themselves for having gone through that.
Right.
Like what we spoke about, like what I mentioned just now, there can be so much shame attached to it. There can be so much feelings that are difficult to tease apart, and sometimes the teasing apart alone is already very difficult. Only because it's daunting.
Yeah.
And it's scary, right? Yeah.
And this is the same thing that you mentioned about being careful to not re-traumatizing the client.
Yes.
Yeah, and so I kind of want to use the question that I started with. Can therapy cure trauma?
Ooh, cure is such a big word, right? But I think maybe we don't use the word cure lah. We use the word heal from it.
Right.
Okay, and that can look so different for everyone. And something to also note is that it's not a linear progress, right?
Right.
It can be so up and down, but progress is progress. It can come even in the form of, I'm aware now that this is why I function this way, or this is how it impacts me. Any small progression is still progress, and it will be invaluable in allowing the client to realize. That awareness in and of itself, right? You'll be surprised at how much it empowers the client. It's like, I realize when this is happening.
Yeah.
And then it empowers them in allowing them to realize, maybe I can respond differently.
Because they're aware now. They put that, okay, this is the thing. Yeah.
And the thing about trauma is that it sticks.
Yeah.
Right? Fear is a survival response. So technically our brains are doing exactly what it's supposed to do lah.
Yeah.
Right? But because it's driven for survival, it will stick.
Right.
So it is also acknowledging that the impact will be lasting.
Right.
It will not go away so fast, and the fear could potentially be there forever.
Yeah.
But it's also recognizing that I can respond to the fear differently, or
Right.
I am aware of the fear now. So when it comes up, I see it. You know, so I think that is the essence of healing.
Yeah. So is this why the video that I was watching, the doctor explained someone who went through trauma, it rewires their brain
Yes.
because they're like, okay, if this happens, then this is how I have to act. And that's kind of the same thing that you mentioned about relationship. Now that they relate this certain thing with the fear of abandonment, so this is how they should react because that's how they're used to it.
And on that note, the rewiring of the brain, like what I said, is the survival response. If, for example, and like I said just now, right, the 3 Fs, the fight, flight, and freeze can manifest so differently. I'm just going to use this example.
Right.
The abandonment one. If they see that, oh, I could potentially be abandoned, or this person is pulling away, or something like that,
Yeah.
then they will fight it, for example, and say, oh, I'm going to create more value for myself, I'm going to do more. Whereas, with the other example, person B, they ran, they fled. It's avoidance. I don't want to experience it, so I'm going to go first.
Yeah.
So, yes, your brain does get rewired. I mean, we can go right down to a rabbit hole to like the physiological manifestations of trauma and how it changes things in your brain. But it's true, yeah.
So, kind of, okay, with therapy, right? Like, is there an ultimate goal of informed therapy, trauma-informed therapy?
I think the biggest goal that we try and get to first before we even work through the trauma is regulation.
Yeah.
So getting the client to a place emotionally, mentally where they feel somewhat safe and they're not as reactive or responsive to trauma or stimuli that remind them or trigger that trauma again. And once we get there, only we can start doing the unpacking and the trauma work.
Right.
So for me, from my practice and from my understanding of trauma-informed care and trauma-informed practice, my biggest goal is to get the client to understand themselves better. As a person who has gone through whatever that they had gone through and the impact that it has left on them, and then to explore how they wish to move forward.
Right.
So that is very client dependent. You know, I emphasize a lot on, okay, what do you want to do from here on? And so it's very dependent on what the client wants to achieve. But at the same time, what we try to achieve with regards to dealing with trauma is regulation and safety first.
Okay.
Before we can even move forward.
Right. So that is the first thing that therapists would tackle. Yeah, and just kind of for our last question, what would you say to a trauma survivor who is scared to start therapy?
That it's completely normal to feel that way.
Yeah.
That the fear is there for a reason, and that it's okay to feel scared.
Right.
But at the same time, therapy can be very effective.
Yeah.
It can be very helpful, and it probably will be a difficult process as well. You know, I think a lot of people come to therapy in hopes to feel better.
Yeah.
But sometimes when we unpack such painful, such confronting realities, it stirs up a lot of feelings, you know. And so what I would tell, you know, trauma survivors is that the therapy process is definitely nowhere close to linear. It's up and down, up and down. And some days you will feel like, you know, you're really back to square one.
Yeah.
But in building more self-understanding, in recognizing and accepting what has happened to you, it can be very empowering.
Yeah.
To be in that space of understanding and recognizing, okay, I know this now.
Yeah.
What do I want to do from here onwards?
Right. So that's also what I saw people say, that during the healing process, you might feel like, oh, I'm healed, like this is amazing. But then suddenly one night you feel like I'm back to square one, just like you said. But that is where therapy comes in, right? When you have that moment where you feel like I am stuck and the trauma is playing back in my head, now I have the skill set to know how to overcome or to manage the thoughts that I have right now, right?
And I think something also important to note here is that as human beings and as people, we're ever changing, right?
Yeah.
And it's also coming to that realization that perhaps whatever has worked for you in the past no longer works right now, and that's fine. We can find new ways to cope, and we can work together to see what works best for you. Yeah.
So you can just keep moving forward and find ways that can help you. And I think that's a really great advice given from you. So I think that brings us to the end of this episode on trauma-informed care. Thank you so much, Betty, for all your sharings and like answering these like serious questions about trauma. I think it's really helpful for a lot of people. So if you are a trauma survivor or know someone who is, just know that there is hope and help available. So we will include some hotline resources in the description, as well as Betty's profiles for you to check out. And thanks again, Betty, for sharing everything. And to all our listeners, if you enjoyed this episode, please subscribe and share it with your friends. And we're also available on Spotify, Apple Podcasts, and most of social media platforms, so just check us out over there. But I think that's all, so until next time, take care everyone.
Thank you.
Thank you.